Hello, I am Rishu, team leader of Dexter Delights. Today, I am excited to introduce our project, Asha Bandhu, a digital companion designed to support Asha workers in rural healthcare. In rural areas, Asha workers are the first line of healthcare, but they face several challenges: limited access to digital records, difficulty in managing patient data offline, language barriers with patient, lack of real-time support from hospitals and pharmacy. To solve these problems, we built Asha Bandhu, a multilingual, offline-first app that empowers Asha workers and bridges the healthcare gap for rural community. Now, my teammate Bikram will explain how the Asha Bandhu app works.
So here's the home page, and if I'm clicking on continue, I'm directed to the supervisor and Asha worker portal. So what the supervisor does is basically she is the Asha Sangini. She manages different Ashas. She can also create new Asha IDs of the Ashas newly registered to the government policies, and she can also view the reports submitted by them. So if I'm clicking on login, I'm directed to the supervisor portal. So as you can see, I have over here the create Asha ID feature. From here on, I can create a new Asha ID. I can also view the reports submitted by them. I can also view the critical cases. As you can see here, I can add the new Asha details. I can also view the existing Ashas, and I can view the critical cases submitted by them in their respective subcenters. That is a very important feature that needs immediate attention. So we've highlighted that with bold colors, and we're back at the portals page, and from here on I'm going to log in into the Asha workers to show you the Asha dashboard. So what the Asha does is basically she visits the houses of the pregnant women and children, and she advises them on various government policies. She foresees the registration and such. She basically assists them with the pregnancies and the care of newborn babies. So as you can see, now I'm directed to the Asha worker dashboard. Here we have several features, the most important one being adding a new pregnant woman or a new newborn baby. So as you can see, we have all the information that we need of the woman and the child, and we can add that. They can get registered quickly. That's a very crucial step in the process. That's the very first most step. And from here on, we can also view the critical cases that we might have added. We can also submit the visits that the Asha might have had in her own subcenter. She can enter her observations. She can enter the symptoms that she might have observed over there. That is also part of her daily duty to report to a supervisor. You can also view the critical cases. We have divided it in 3 subcategories. The most important one being urgent, of course. And from here on also we have several health education features that we can tick mark whether the Asha has spread over the region that she's visited. So basically we have different kind of health education goals for the pregnant women and children, newborn children, and from there on we can just tick mark, the Asha can just tick mark the education guidelines or the processes that she has already foresighted.